Am I stupid? I mean, I'd like to think not. But Dr. Lynch, purveyor of the buzzy new PDGF treatment in aesthetics, might argue otherwise. You see, he may think it's stupid that I have serious concerns about taking a drug which is very well studied for diabetic foot ulcers and bone grafts, and using it as a cosmetic injectable for the face for aesthetic indication.
Well, some of us are doing it off-label. We post about it. And then we get haters chiming in on a public forum that are other physicians, other nurses, saying you're doing something illegal, and just saying how dare you put your patients at risk, blah blah blah.
Well, this is going to be an unpopular opinion, but I do think you should be in jail.
That's like stupid. I mean, I'm sorry, but it's just like, look, the biology of tissue regeneration is the same regardless of where you're at in the body.
Look, I may not have gone to Harvard, and I may be a few unsavory things, but stupid is not one of them. And neither are you if you've been asking these very same appropriate questions.
As you can see, there's a lot of controversy on social media in the aesthetic circles surrounding the treatment I consider to be the miracle regenerative treatment we've all been waiting for. In this article from Aesthetics Unfiltered, critics question whether or not PDGF is the modern-day version of hope in a jar or hype in a syringe. Then there are these posts from one particular provider based out of New York saying that she's seeing a lot of complications coming from people who have been injected with PDGF, things like prolonged redness, swelling, and nodules. Does PDGF cause cancer? Is it really safe to use? If you're feeling unsure, or you just want the full story behind all the controversy surrounding PDGF, also known as RE-essence, you're going to want to keep watching. I'm breaking it all down. The facts, the fear-mongering, the science, and everything in between when it comes to this hot new regenerative injectable. So let's get into it. It's important to know that I am not currently sponsored, nor do I work for any pharmaceutical or aesthetic company, so I have no conflicts of interest to disclose. All of my references to the studies will be listed in the description of this video if anyone wants to take a look. So let's talk about the conversation that's been unfolding on social media. Recently, Dr. Subio, who, by the way, is one of the most entertaining voices in the aesthetic industry and someone I truly admire. I love him. I met him a few times in person, and I admire him because he has a fearless, say it like it is style. He posted this reel about PDGF.
In this webinar about PDGF last week, they asked Dr. Lynch how to arm yourself against those who claim that there's no good evidence about using PDGF as an aesthetic treatment. How to respond to those who claim that though it's well studied in diabetic foot wounds doesn't mean we should be making claims about how it acts in the tear trough in unwounded skin. And he said this.
I mean, that's like stupid. I mean, I'm sorry, but it's just like, look, the biology of tissue regeneration is the same regardless of where you're at in the body.
The biology of wound regeneration is the same all over the body? A wound in the oral mucosa, which heals in like 5 minutes, is that the same as the heart, where infarcted myocardium is replaced with permanent scar? Is that the same as a heel wound in the foot of a 70-year-old diabetic smoker, where the thick, glabrous skin is sitting in a chronic mix of inflammatory cytokines? Is that the same as the tear trough skin in a 40-year-old soccer mom that doesn't even have a wound there? Is the biology the same in all these examples? Obviously not. It's preposterous. So again, am I the stupid one to ask if we should be selling this as an injectable to treat non-wounded tear trough skin? I mean, should we be making claims like it can volumize or can decrease the need for Botox or can improve fine lines and wrinkles with no evidence other than diabetic foot wound studies and, hey, I tried it on my mom and she loved it?
So he was referencing Dr. Samuel Lynch, the guru behind PDGF. When Dr. Lynch said the biology of tissue regeneration is the same all over the body, I think he was speaking from that meticulous cellular level science. He and his team have spent years understanding how platelet-derived growth factor interacts with the body and its cellular receptors. I actually attended a pharmaceutical dinner program just last week for PDGF, and I had the chance to ask Dr. Lynch several questions. But as mentioned before in another video, this wasn't my first conversation with Dr. Lynch. I actually spoke with him and his wife early on when I first started using PDGF, and they answered all my questions. He spoke in depth about how they uncovered the cellular biology of tissue regeneration, how the body even recognizes that it's been injured. And once it does heal and regenerate tissue from an injury, how does the body recognize that it healed so it can stop the wound healing process? He understands tissue regeneration from that scientific cellular level because he's been working in the field of regenerative medicine for over 30 years. So when he says the biology of tissue regeneration is consistent across the body, he's likely referring to the universal cellular principles being the same, the actual signaling pathways like PDGF binding to its receptors, triggering fibroblast activity, angiogenesis, and collagen synthesis. I think what he was getting at is that if PDGF works beautifully for medical indications like wound healing and bone grafting, then it's reasonable to explore how it performs in aesthetic context. But here's where the nuance comes in. Dr. Subio, as charismatic as he is, might have taken the comment a bit out of context to make his reel more sensational. And that's okay. We all know social media thrives off polarity and black and white takes. I respect Dr. Subio's perspective and his fearless approach. He's a free thinker and he sparks really important conversations that we do need to have. But it's also important for us to recognize the full picture and the context behind the sound bites of his reel. Now, there are a few posts circulating on social media questioning whether or not PDGF even works. Is PDGF just modern-day snake oil? They listed the top 5 evidence statements for PDGF in aesthetics as, the proof is in the pudding. It worked on my auntie's face. Trust me, bro, it's legit. The rep said it regenerates everything. Evidence, smevidence. It's funny, but here's the thing. I'm a very skeptical person. Even when a treatment is FDA approved for cosmetic use for something, I don't buy into the hype until one, I either try it on myself and see results, and I try it in my patients firsthand and see results. With PDGF, I've done both. I treated myself first, then I treated colleagues and then patients, and they saw it too. And I was really impressed and amazed by the results, and that the results didn't seem to completely go back to baseline like the other regenerative injectables or biostimulators. And that's what made me a really big fan. So to all the providers who are skeptical, have you actually tried it? Because here's the thing, if the clinical studies of any aesthetic drug said it worked, but I didn't see real world results, I wouldn't care what the science said. People are doing aesthetic treatments to see real clinical results, regardless of what the science or any sales rep says. Now, a provider based in New York shared a series of controversial Instagram posts about PDGF. This one particular post was shared over 2,000 times and got over 400 comments. This beautiful woman was injected with PDGF intradermally. She has had these nodules for 3 months now with no change. She reached out to REScence and their trainers. They recommended microneedling and lasers. Microneedling and lasers will not help and will potentially make things worse. And this is why you do not inject a non-FDA approved product into your skin. Drugs and biologics need to be studied for both efficacy and safety. If PDGF had been adequately studied, then we would know that it causes nodules, granulomas, and other long-term complications. Fortunately, a study on intradermal PDGF complications was conducted on 65 patients in China. They tracked the complications and figured out how to treat them. This is the protocol that I will be using to manage these complications. So I decided to speak to the lead scientist from the company that makes PDGF to track down and review the study that Dr. Gersman was referencing in her Instagram post, because these side effects sound very scary. In the article, you'll find pictures of people who were treated with growth factors and had side effects and complications such as facial flushing, sensitivity and itching, subcutaneous tissue hypertrophy, abnormal hyperplasia, and hard lumps. Hyperplasia extending beyond the normal range, affecting local function, ulcerations and purulent discharge resulting in significant pain and psychological suffering. So, of note, the claim Dr. Gersman is making against PDGF in this post referencing this study is extremely misleading, because none of these patients who had these complications from getting injected with growth factors in China, none of these growth factors were PDGF. They were treated with other growth factors like vascular endothelial growth factor, epidermal growth factor, and basic fibroblast growth factor. So we think that was just what was reported by the patients in China. Here's a picture of the growth factors. It shows a powder you mix with a liquid, 2 separate vials. This is not PDGF. Also of note from the study, some of these exogenous growth factors were injected in a non-professional setting, and some of them were mixed with hyaluronic acid fillers. I've linked the study in the description of my video if you want to check it out, but you probably won't have access to the full article with all the gory pictures. But what matters most is knowing this. All growth factors are not the same. There's only one FDA-approved growth factor for tissue regeneration, and that growth factor is PDGF, short for platelet-derived growth factor. There's a reason that scientists wanted to isolate the gene for this particular growth factor so they could grow it and use it. It's because PDGF has a very unique profile. It's very balanced when it comes to regeneration, unlike other growth factors that can overstimulate the healing process and lead to excessive fibrosis or scarring. PDGF orchestrates wound healing in a very controlled, orderly way. It recruits the right cells, stimulates collagen production, and promotes angiogenesis, but without tipping into overdrive. So the study Dr. Gersman was speaking about in her Instagram post with all those patients who had horrific side effects from having growth factors injected into them, again, none of these growth factors were PDGF. But let's talk about how PDGF actually behaves in the body, because once you understand its biology, you start to see why it's safe. So how does PDGF behave in the body?
PDGF is a locally acting growth factor released at the site of injury and interacting with local cells through the PDGF receptor present on multiple cell types. Binding of PDGF into PDGF receptors results in receptor activation, followed by internalization of the ligand receptor complex into endosomes. The PDGF receptor complex is then dissociated, and the receptor is recycled to the cell membrane, or the PDGF receptor complex is degraded.
So what does this mean? Natural PDGF that your body produces is what we call a locally acting growth factor. It's released right at the site of tissue injury where it binds to cell receptors that are already present in the area. Once that connection happens, it triggers a cascade of cell activity. Then the whole complex gets internalized into the cell to either be recycled or cleared out. So how does exogenous recombinant PDGF work? Is recombinant PDGF safe? Remember, recombinant PDGF, or the lab-grown PDGF, is 1,000 to 300,000 times more potent than the PDGF that's naturally in your body.
The pharmacokinetics of exogenously added PDGF, including recombinant specifically, have been well studied when applied both systemically and locally. Systemic pharmacokinetic studies in, let's just say, animals demonstrated that the half-life of PDGF is short with an observed range of 2 to 55 minutes, even with intravenous doses of 23 times the maximum dose.
So regarding the PDGF we would inject in the office, the body is incredibly efficient with it. Any excess recombinant PDGF that isn't used is neutralized by natural cleanup mechanisms. So you're not left with growth factor floating around. It does the job, then it's gone. That's also what makes it safe. Studies showed even when PDGF is given systemically in animal models, it has a very short half-life, anywhere between 2 to 55 minutes, even at doses 23 times higher than what's used clinically. It doesn't linger or accumulate. In localized applications, like we're doing in aesthetics, it's logical to conclude that it would behave the exact same way. One study showed that about 50% of the PDGF applied to a surgical site was already gone within 30 minutes, and only about 10% remained after 72 hours. So the takeaway, it works fast, stays local, and clears predictably. And that's what gives PDGF such a clean pharmacokinetic profile. But let's review other important takeaways from this white paper if you're still worried or concerned.
The role of platelet-derived growth factor in wound healing and regeneration has been extensively studied for over 3 decades. Millions of patients are estimated to have received treatments with recombinant PDGF BB containing products. The safety of recombinant PDGF BB has been thoroughly evaluated through clinical safety studies and post-market clinical studies.
These studies are crucial because they go beyond the controlled environment of clinical trials. It's one thing to prove safety in a trial, it's another to see that safety profile hold up in real-world practice. And that's why I feel confident injecting it. What's important to remember about PDGF being injected is that this product is not currently approved to be used for cosmetic injections, but it is approved to be injected for medical reasons. That said, as a provider who deeply believes in the power of regenerative aesthetics, I was curious to see how this would work in an aesthetic context, especially when it comes to stimulating collagen, elastin, and hyaluronic acid in a more natural way compared to synthetic biostimulators like Sculptra or Radiesse. So, like many of us who love regenerative injectables and are passionate about innovation, I started out slowly and carefully, treating myself first, then colleagues, and eventually a few patients who were equally curious. But because it's not approved for cosmetic use, there's no formal official training provided. So everything we're learning, like how it behaves at different dilutions and how much to use in delicate areas, is based on clinical observation and experience.
I actually had a doctor recently come shadow me all the way from Norway just to learn more about PDGF. I utilize regenerative injectables like Renuva, which is more biocompatible with the body, and biostimulators for anti-aging more so than I do filler. I think filler has its place for enhancements, but I've been using and injecting biostimulators like Sculptra for over 10 years, and I'm a big fan of them. When Sculptra first came out, the reconstitution was very low, which means it was more potent and highly concentrated. So they noticed more robust results and it worked faster, but the risk of nodules was higher. So we learned by trial and error, and now most providers use a higher reconstitution to try and avoid the risk of nodules, and that's why we really don't have as many issues with nodules now with Sculptra. So far, I haven't had any issues with PDGF on my patients or myself.
And I've actually treated very risky areas in terms of nodules with PDGF, areas like the forehead and upper eyelid skin, which is the thinnest skin on the face. So if you were going to have nodules or issues here, like prolonged swelling, it would likely be here. So for all the people who've been reporting to have issues with PDGF to their under eyes, things like papules and swelling, I have questions.
Did the patient already have filler in their tear troughs? Apparently, people who have filler to their tear troughs already are having more complications from PDGF to their under eyes. What dilution did the provider use? Was it reconstituted with saline or was it injected straight? These are the questions we need to ask when we hear about complications. The reality is that some providers are purchasing PDGF without doing the proper research. Because remember, there's no formal training on this because it's not been used for cosmetic purposes before. So they might not understand that topical use and injectable use require entirely different protocols. And there's a difference in how you prep or mix it when it comes to injecting it versus applying it topically. PDGF in topical form is known as RE-essence. And when you apply it topically, it's mixed with hyaluronic acid, the hyaluronic acid that comes with it. But some providers are mistakenly mixing it with the hyaluronic acid that comes with it and injecting it into the skin. How much volume did they inject? I only inject to correction, so no one leaves looking extremely swollen. Now, what I have noticed that can sometimes happen after treatment is sometime maybe around 48 to 72 hours after injection, you can get this firmness and maybe even redness to the skin, which I spoke about in this video. The firmness happened to my under eye area 2 days after injection and lasted for around 2 days.
And I had both firmness and redness happen a few days after injecting my pre-auricular area. This red raised area lasted around 2 to 4 days. This was the only visible raised area that I ever had after injecting PDGF. And I've treated multiple areas on my face, so I wasn't worried. I knew the issue would resolve and soften up, and it did exactly that. Days later, the red area completely softened up.
I think the swelling and firmness was from the surge in hyaluronic acid, and a few of my patients have also had the same experience. They developed firmness a few days after injection, but then it softened up after a few days, and I warned them that that could happen. So despite the fact that PDGF is only approved for medical use and it's not currently approved for aesthetic use, doesn't mean it can't ever be used that way, but some would consider it to be in the gray zone and still investigational for aesthetic injectable use. Interestingly, Botox was first FDA approved for medical use, specifically for conditions like blepharospasm, which is involuntary eyelid spasms, and also for strabismus, otherwise known as cross-eye. That happened back in the 1980s. But then providers, particularly those in ophthalmology and oculoplastic surgery, they began noticing that when they treated patients for these medical eye conditions, the wrinkles around their eyes or crow's feet started to soften as a side effect. From there, these early adopters began to use Botox off-label, meaning for a purpose not yet approved by the FDA to treat wrinkles. They thought, hey, this is actually working wonders for frown lines and forehead creases. Maybe we should look into this more formally. This eventually led to the clinical studies focusing on cosmetic indications, and by the early 2000s, Botox was officially approved for cosmetic use. So yes, it was the innovative providers, those early adapters, who first realized the wrinkle reducing potential and paved the way for the cosmetic use that we now know today.
So what about all the concerns of PDGF causing cancer? In relation to cancer, non-clinical studies and long-term clinical follow-up demonstrated that recombinant PDGF was non-immunogenic, non-clastogenic, non-carcinogenic, and established that there was not an increased risk of cancer incidence or cancer mortality following single-time implantation or repeated daily
topical application of recombinant PDGF. As a matter of fact, in 2018, the FDA removed the black box warning based on a review of follow-up clinical studies that found no evidence of increased risk of cancer incidence or mortality among recombinant PDGF treated patients. For context, out of 400 black box warnings added to the labels of drugs by the FDA, only 6 have been removed, and this was one of them. So, in summary, recombinant PDGF has undergone extensive non-clinical and clinical safety evaluations when exogenously applied via various routes of administration, including topical, surgical implantation, and subcutaneous, intradermal, intraperitoneal, or intravenous injections. The totality of the data demonstrate that recombinant PDGF, when applied exogenously in a single or daily dosing applications, has a favorable safety profile with a strong track record of safe use for over 25 years. If you want to check out the white paper that was referenced and go deeper into the science regarding cancer or anything else, check out the link in the description of this video. Even though PDGF is currently only approved for medical injection for specific conditions and uses, based on what I've seen in practice, I'd argue its aesthetic potential is worth paying attention to now, not years from now. So the question is, do I want to wait for the FDA to greenlight this for cosmetic use? That process can take years. And while I'm all for regulatory rigor, we've seen how even FDA approval doesn't guarantee safety. Just look at Vioxx. It was FDA approved for pain relief, prescribed to millions, and only pulled 5 years later when post-market data revealed serious cardiovascular risk. Since the early 2000s, there are more than 5 other drugs that have also been pulled from the market after the FDA approved them. It's very important to question things, and we don't know everything when it comes to how this product behaves cosmetically. But to outright say it's unsafe to be injected, in my opinion, from all the scientific and clinical evidence that we have, remember, PDGF has been used since 1997. If it was unsafe or if it caused cancer, I think we would know by now from the medical side because it's been used for almost 30 years. There's no reason that I personally think that it's unsafe to inject for cosmetic purposes. So then why all the buzz around this product lately? Let's be honest, controversy gets clicks. Hot takes get traction. And in a sea of aesthetic content, the quickest way to stand out is to stir the pot. Social media thrives off extremes, and nothing spreads faster than cautionary tale. We saw this recently with Dr. Suvia's comment at the Aesthetic Next conference. He was clearly joking when he said the injector should go to jail.
Well, this is going to be an unpopular opinion, but I do think you should be in jail. No matter
Then it could be true.
After careful consideration, minimum.
Can I still get my Botox?
But the joke landed and it sparked conversation. But here's what else we can't overlook. Beyond the buzz and the banter, there's a much bigger force at play. Conflicts of interest in medicine. It's worth pointing out that not all, but some of the most vocal critics of PDGF also happen to serve as speakers, trainers, or paid consultants for major aesthetic pharmaceutical brands. The very companies behind traditional fillers like Juvederm, Restylane, or other hyaluronic acid-based injectables, and collagen stimulators like Sculptra, Radiesse, or some of them work for other regenerative medicine companies like Acorn Biolabs, and this could be seen as direct competitors to PDGF. These partnerships aren't inherently wrong, but they definitely shape opinions, messaging, and even what gets amplified on social media. I'm bringing this up because in aesthetics, as in any industry, it's important to understand who's behind the messaging. Many injectors aligned with big pharma brands earn a substantial portion of their income from these partnerships, and this influences what they promote, or in this case, warn against or downplay. And when I say substantial, I mean it. The financial incentive is real. Some providers make more serving as trainers, speakers, or key opinion leaders than they do in treating patients. Again, this doesn't mean their opinions aren't valid. It just means we have to recognize the context. And currently, I'm speaking from clinical experience and curiosity, not from a contract. What's interesting to me is that I haven't heard any of the people who are questioning or criticizing PDGF mention what I consider to be the most invaluable thing about this regenerative injectable, which is that there's no risk of vascular occlusion, and that's because it's water-based. I can safely treat risky areas that I don't feel comfortable trouble treating with filler. I have been dreaming of a product like this that was water-based, that couldn't clog a blood vessel. But I want to know, what do you think? Would you be open to trying a regenerative treatment like this, or do you prefer to wait until there's formal approval for cosmetic injectable use? Let me know your thoughts on this. Leave a comment below. If you're in the Los Angeles area or you want to travel to Los Angeles to try this treatment, check out the link in the description of this video on how to book. Also, if you're doubting the results of PDGF, I've had great results so far, even with hair growth. This is after one single treatment of PDGF injected into the scalp for hair loss. If you want to see more before and after photos of real results of patients that I've treated, or to learn more about this growth factor, watch these videos.